Look at the quiet kid in the third row, the one who never speaks out of turn, always finishes their assignments, and is frantically erasing a smudge until the paper rips. To a teacher, that looks like an ideal compliant student. But at home, that same child is dealing with bedtime tears, frequent sick days, and persistent stomach aches every single morning before the bus arrives. When we think about mental health crises in schools, we typically picture loud disruptions, acting out in class, outward acts of defiance, or a sudden drop in grades. Because educators are trained to manage those visible disruptions, a massive portion of student suffering goes completely unnoticed. It hides in plain sight behind the behavior of a good kid. This diagram shows the prevalence of childhood generalized anxiety disorder. It affects nearly 1 in 12 children. Because these eager-to-please students don't trigger the usual behavioral alarms, GAD remains one of the most underdiagnosed conditions in K-12 education. Recognizing this paradox, that extreme compliance is often a distress signal, is the absolute prerequisite to catching the students who are quietly falling through the cracks. Normal childhood worry is temporary. Generalized anxiety disorder is a persistent, overwhelming sense of dread that is extremely hard to control, no matter how much reassurance a child receives. A central GAD node quickly branches out, projecting anxiety onto multiple life domains, affecting school performance, friendships, and future safety. That constant mental load exacts a severe physical toll. Children frequently experience chronic restlessness, severe muscle tension, and struggles with sleeping. A student frequently visiting the nurse with a stomachache or a headache usually isn't fighting off a virus. They are trapped in a systemic psychological feedback loop. To intercept this cycle, school staff need a specific observational framework to identify the anxious good kid before they withdraw completely. There are 3 specific clinical signs to look for. The first is chronic somatic complaints, specifically a regular pattern of unexplained physical symptoms like headaches and stomach aches right before school. The second clinical sign is excessive reassurance seeking. The student constantly needs a teacher or a peer to confirm they are doing an assignment correctly over and over again. The third core sign is paralyzing perfectionism. The fear of getting an answer wrong becomes so intense that the child avoids the risk and completely stops participating. Training staff to spot these 3 specific signs allows them to stop viewing quiet avoidance as a personality trait. It reframes the behavior into a clear cry for clinical intervention. The encouraging news is that generalized anxiety disorder responds well to evidence-based treatments, primarily cognitive behavioral therapy, along with medication when prescribed by a licensed clinician. The critical bottleneck has always been access. Getting a K-12 student into a licensed clinician's office during the school day is nearly impossible for most working families. MentalSpace School solves this access gap. Their model embeds dedicated HIPAA and FERPA-compliant teams directly into Georgia's K-12 campuses to provide same-day teletherapy. Bypassing traditional access barriers through integrated teletherapy allows clinicians to intercept GAD before it permanently derails a student's academic journey. Partnering with clinical services like MentalSpace provides districts with clear, quantifiable metrics on student outcomes. Looking at the data in this chart, the results are direct. School attendance rates improve by 89%, while self-reported student anxiety drops by 92%. That impact extends into the wider community, resulting in an 85% family satisfaction rate among those receiving support. These metrics objectively prove that treating hidden anxiety directly rescues individual student well-being and improves the overall performance of the district. The financial framework makes this scalable. Out-of-pocket costs for Medicaid are $0, and the service accepts major private insurances like Blue Cross Blue Shield, Cigna, and Aetna. Adopting this infrastructure also addresses immediate legislative urgency. It directly supports Georgia districts in meeting their HB 268 compliance mandates well ahead of the July 2026 deadline. When we unmask severe perfectionism and physical pain as anxiety, we finally have the tools to save our quietest students. Providing culturally competent, school-partnered therapy ensures that professional care is no longer a separate, difficult-to-reach luxury for Georgia families. To bridge this gap for your district, visit mentalspaceschool.com.